Now, uMgungundlovu, the district municipality in KwaZulu-Natal, has become the hardest hit in terms of COVID-19 deaths. On Saturday, the district accounted for 70% of deaths recorded in the province of KwaZulu-Natal. Now, in the past week, over 60 people have died from COVID-19 in that particular district. Joining us now to talk to us about the alarming death rate in uMgungundlovu is KZN Premier Sihle Zikalala, and he joins us online. Premier, thank you very much for your time. I want to start off with something unrelated to COVID-19 just for a second. Your province experienced something very, very unusual in our country, the beheading of people on the street in broad daylight. This on the back of reports that a well-known drug dealer was shot dead. Your reaction, Premier, to the scenes that we saw yesterday, but also importantly, the proliferation of drugs in your province and perhaps a rise in what I would call gangsterism.
Yes, no, thanks, Polly, for having us. This is quite a concerning issue to us, and we condemn in the strongest term what happened in Chatsworth yesterday. We condemn the killing that took place. We condemn also the killing of the two who were beheaded. We believe that we should at all times allow the police to lead in dealing with such a situation. It is very unfortunate that some areas such as Chatsworth and others have become a nest for gangsters and for drugs in the province. We have engaged with the police and they are following on this incident, but we are activating a focused approach in dealing with the issue of drugs in the province, especially it affects urban areas in eThekwini, but when you go also to other districts. And we will be continuing with that, ensuring that we put more effort in dealing with that situation.
Premier, I don't want to spend any more time on this because that's not what we invited you here for, but just importantly, is KZN experiencing a rise in gangsterism, would you say?
I will not deny that there is an indication of gangsterism that is taking place in areas such as Chatsworth, your Phoenix, but also what we have seen happening in Osizweni late last year, where the gangs, a gang composed of young boys, were terrifying people there, killing them and all of that in Osizweni. And it means that we need to do more. We dealt with that situation and we'll continue to deal with these challenges all over.
Premier, I thank you very much for being frank with us in as far as this challenge that faces your province, talking about Osizweni, that's the area in Newcastle. Let me now bring into conversation the issue that we invited you for, and that is that uMgungundlovu, the municipality there, it's been described, I think it was the Witness newspaper, as a COVID-19 death hotspot, if you like. I'm not using the actual words because that paper disappeared in front of me here. But in your own words, Premier, why would you say that uMgungundlovu has become a COVID-19 death trap right now?
Well, firstly, we should put clear facts that the number of deaths are higher in eThekwini. But uMgungundlovu, given the level of its population and the level of infections, the deaths are more than what you will expect. As a result, in uMgungundlovu, when you rate in terms of percentage, you will find that in eThekwini, we had so far, we had experienced 2.1 fatalities. But in uMgungundlovu, it's at 2.7. And therefore, it tells you that there are a number of challenges. One of the challenges that we are experiencing is a high number of people who comes to healthcare facilities at a late stage. So people will be infected, others will not even want to be tested and will arrive late for medical attention. There is also what is worrying, the increase of deaths that take place in homes and get reported when people goes to mortuaries, where we then begin to test those people at that time.
Premier, the issue here of COVID-19 deaths in KwaZulu-Natal, it's something that you've also attributed to a lack of adherence to COVID-19 protocols, including the failure to wear masks, and that you say it is largely to blame for the recent rise in infections. Are you finding that people are simply not adhering to these non-pharmaceutical interventions, wearing a mask, sanitizing, and keeping the distance?
Well, the majority of our people are adhering. But unfortunately, if you go to townships and rural areas, you will then find people who think that the wearing of masks must be done only to conform to government intervention, which is wrong. Because people must understand that you must wear mask with or without government intervention in terms of enforcement. Now, if you go to a township, you'll find youngsters saying, yeah, we wear a mask when they are police, which is a problem. You are not wearing mask for police. You must wear mask for yourself and for your own protection. And that's what we are doing. We are dealing with mass education. Must always enforce and complement the interventions of government.
Enforcement?
But people also must not take things complacent. The tendency of complacent is affecting us in various areas. Hence, we need to do more to conscientize people.
What about the issue of enforcement, therefore, Premier? People who clearly are not going to adhere, and they are obviously dismissive of any instruction that they are being given in as far as the adherence to the regulations. What are the penalties?
That is the priority. We are ensuring that compliance is enforced in all areas. Hence, we have had a number of roadblocks, checking people whether they are wearing masks, and those who were not wearing masks who have been taken out of the public transport. We are now moving to the stage where we are charging people who are not wearing masks. So compliance will be enforced in all areas. And we have also activated our district command council to operate fully and ensure that compliance is adhered to in all areas.
Premier, while the people might be to blame for a situation that is clearly slightly getting out of hand, someone who goes by the name Moses Mncwabe here on Twitter has asked me to ask you this question, that the issue of incapacity, he says, and deterioration of uMsunduzi municipality in all aspects. These are his words. It says there's a problem of incapacity and general deterioration in all aspects within the uMsunduzi municipality. In your view, what is he talking about? And is he correct to describe the uMsunduzi municipality as deteriorating and completely incapacitated?
I would say partly he is correct, and we have taken a blame on that as the governing party, the ANC, and we are dealing with the challenges. There has been a deterioration which has been there for the past years, and we've intervened. You will remember that we changed the council leadership. But we have also acknowledged that uMsunduzi, like other old towns, they are facing a number of challenges, including dilapidating infrastructure, which always affect its performance. And therefore, we are intervening now. We can safely say that politically and administratively, we have improved, though we have not reached a level where we would say we are fully confident. Hence, the provincial government continues with the intervention to support the municipality. And that's why the municipality has been placed under Section 139B to ensure that the provincial government is assisting. I must say the point raised by Mwabe is correct. It is attended to, and we promise that we will ensure that the challenges that are prevailing are addressed.
Final question to you, Premier. The issue of frontline staff, medical workers in your province. The union DINOSA, which represents nurses, is complaining bitterly, Premier, that medical staff are not well looked after in your province. What's going wrong?
Well, I wouldn't know what is it that it's an issue, but what I know is that DINOSA has a very good relationship with us in terms of advocating and raising issues that are affecting healthcare workers. Even myself, they interact with me and they call me. I will make a follow-up because the last time we engaged with them, which was, I think, October last year or maybe September, we dealt with all issues to their satisfaction. But if there are new developments that maybe we are not aware of, we will follow on those.
Premier Sihle Zikalala, he is the Premier of KwaZulu-Natal province. Thank you very much for your time.